that you're connected to audio, so can see us and hear us. Welcome. My name is Andrea Merriam. I'm with Parkinson Movement Disorder Alliance. Very excited to have you here to join us. So today we're going to be talking to Dr. Khalsa. He's in Oklahoma. We're going to be talking about anxiety and depression. And as always for this series, we're going to be led through this topic and this interview by movement disorder neurologist Indu Subramanian, who practices out in Los Angeles. So I will cede the floor to you, Dr. Subramanian, and thank you again to both of you.
Thank you. Thanks, everyone. Good to see everyone in our virtual support group world and trying to stay socially connected while being socially distanced, which is, I think we're on week 5 maybe of this at this point. I've kind of lost track of the days. But I've just been trying to find great speakers who can bring a different perspective to help us through this time and also to teach us about the mind-body connection. I think that there's no one better to talk about that than Dr. Khalsa. He has an MD and a PhD. He was at UCLA for some time. We overlapped, but didn't actually work together when he was here, but he's now at the Laureate Institute for Brain Research in Oklahoma, and he's affiliated with the University of Tulsa there. We've been trying to bring him back this way. So hopefully we'll have some more collaborations and maybe one day bring him back to sunny Los Angeles. So he has just a really interesting background, and I will be digging into how he kind of developed these interests. But really his main research focus have been largely about the brain, the mind, and the body, and the connections of the interplay between various sensations in the body and the mind. And I think that really lends itself well to Parkinson's disease and some of these topics around anxiety and mood and things like that. So maybe I will hand it off to you, Sahib, first, and then we'll have you teach us around the slides, and then we can have maybe a discussion. We'll get some comments and questions as we go from the audience, and can kind of incorporate those once we are kind of through your slides.
That sounds great. Can you hear me?
Yeah.
Okay. All right. Well, thank you, Indu, and to the Movement Disorder Parkinson's Alliance for having me here today. It's wonderful to see everybody. One of the nice things about the new sort of Zoom approach is that you get to meet people from all over the world, and I can actually see your faces. And in some cases, your kitty, which is awesome. So it's nice to kind of connect in this way, in a new way, and hopefully bring about some positive change in the world. So I'm going to start by sharing some information. I have some slides prepared that are based on some of the research that I do to sort of serve as a background. So I'm going to share my screen. And let me know if you can see. I'll turn it into a full screen. Can you guys see the screen there? Okay, excellent. So, so basically, what I thought I could talk about today was brain-body communication, which is something I'm an expert in, and anxiety, also something I specialize in, anxiety management in the era of COVID-19. Anytime you start out a talk, you just describe your disclosure. So I don't have any disclosures or conflicts of interest. My research is funded by the William K. Warren Foundation, which helps support the Laureate Institute for Brain Research, as well as the NIH. Where am I physically located? Right here, if you can see my mouse, right here in northeastern Oklahoma. Since we can't actually visit the campus of my institute today, this is actually what it looks like. This is the building that I normally work in. Beautiful green campus full of nature, and just sort of a reminder to myself and to us all to try to get outside as much as we can safely. So in terms of my educational background, I sort of was born and raised mostly in the US. But at an early age, I had an opportunity to go spend a lot of my time educationally in India. And so even though it wasn't my college or graduate career, medical career, I spent a lot of time sort of appreciating the beauty. This was a sort of a typical view from one of the schools that I went to, looking out at the Himalayas. This was, of course, before all the smog came in. But there was also a tremendous amount of poverty and population overcrowding. And it really, the experience there in terms of different culture and also learning and practicing yoga and meditation definitely had an impact on my interests and my evolution as a neuroscientist and psychiatrist. I came back to the US to do my undergraduate. I was a psychology major. I went to State University of New York in Stony Brook. And then I, as an indecisive overachiever, decided that I wanted to do both medicine and neuroscience, and got my degrees at the University of Iowa. And this is actually my very first research paper, first data paper that focused on the brain-body connection, something called interoceptive awareness, which you will all be an expert in the next 15 minutes, I promise. But the paper really focused on interoceptive awareness in experienced meditators. And I was really fascinated early on as a result of my experience with meditation traditions in sort of the brain-body-mind connection, and wanted to test that. I had the opportunity to look at sort of the relationship between brain and body directly in neurological patients. This was my second paper. And it really led me to an interest in sort of understanding these concepts at a broader level than just the individual dissection of a neural brain region or a neural circuit that was more common in neurology at the time. So I decided psychiatry was for me. I went to UCLA for my psychiatry residency, graduated in 2013, and focused a lot on the clinical application of brain-body medicine within anxiety disorders, eating disorders, also cardiac arrhythmias. While I was there, I helped to run the anxiety disorders clinic at UCLA, and also started a behavioral medicine program looking at the intersection between anxiety disorders and cardiac arrhythmias. So I was recruited to the Laureate Institute for Brain Research in 2015, and that's where I've been ever since. Formally, I'm the Director of Clinical Operations, and just transitioned from assistant to associate professor. So that's tenure, so I'm happy to make that transition and move forward. And a lot of what I do focuses on really trying to understand the connection between the brain and the body, and its relationship to anxiety. So as a psychiatrist, I'm really trying to bring the brain into, and a neuroscientist, I'm trying to bring the brain into medicine. And these are the three sort of topics that motivate me on a day-to-day basis in my research efforts, to really try to understand neuroscience-based treatment targets so that we can understand mechanisms of psychiatric disorders. We've moved way beyond the era where being depressed or anxious had something to do with how you related to your mother and father. Not that that isn't an important influence, attachment that is, but all of these mechanisms happen in the brain. And so understanding where they happen, and not just the brain, but even in the body, the nervous system at large, motivates me. If we can understand those mechanisms and design novel tests, then maybe we can even develop novel therapies, and I'll touch on some of those. I focus a lot on interoception, which you're going to learn all about. It really is the motivating factor in my research right now. These are some examples of interoceptive organ systems and the types of signals that I study. So what is interoception? We published a review a few years ago on this. Basically, it's the way that your nervous system, which is your brain and your spinal cord, but also your autonomic nervous system, the way that the neurons in those systems sense and interpret what's happening within your body. Your body is constantly sending signals related to how your heart is doing, how your lungs are doing, how your stomach is doing. and your nervous system is processing these signals on a moment-by-moment basis, sometimes you may be aware of it, and sometimes you may be completely unaware of it. But interoception is an umbrella term that covers that. And it's important because when there's an abnormality that needs to be responded to or regulated, it's part of this feedback loop that you can think of as a brain-body feedback loop, where when you detect that something's awry, you need to respond and correct the imbalance. Okay, so sensing and then regulation of the body are critical. This just shows that interoception is currently kind of a hot topic. It's been around for over 100 years, but you can see that in the last 10, 15 years, there's been an exponential increase in interest in terms of scientific papers. There's a nice Wikipedia page on interoception that we put together a few years ago, just outlining again how vast interoception really is. So when I talk about the heart and the lungs and the stomach and the gut, that's just a fraction of what's going on. When you look at the immune system and the changes that happen within the body during inflammation or infection can actually be considered a part of the way that that interoception occurs, and the way that your nervous system is sensing what's going on in the body and adapting and providing fixes. If you think about it in terms of an iceberg metaphor, interoception is sort of the entire iceberg, right? What we see above the surface of the water, there's a whole lot more going on down below. And so a lot of the stuff that your body and your nervous system are doing happen automatically below the surface of awareness. So when we talk about interoception, we usually define the research on it in terms of interoception and then something called interoceptive awareness. And that you can think of as sort of what's in the mind's eye. If I were to ask all of you right now to pay attention to your breath and the feeling of your breath as it comes in and out of your nostrils, that would be a practice that directly involves interoceptive awareness, right? If I were to ask you, you know, what's your blood sugar level right now, or what's the pH level of your blood, you probably couldn't tell me, and that's because that's something that your body and your nervous system are monitoring and regulating in real time without you having to really think too much about it. So there's a whole lot going on below the surface. And a lot of times with anxiety and psychiatric disorders that are marked by interoceptive abnormalities, we really think a lot about what's happening at the level of conscious perception. So how are people feeling, for example, when they're anxious? If they feel their heart rate you know, speed up, and they feel their breathing constricting in their chest, and they're having a panic attack, you know, that's something that they can consciously feel, but there's a whole lot going on beneath the surface. And the other piece of this, of course, is that while there's a lot happening within your brain and body, you know, your body itself is existing within an environment that has a relationship to the outside world. And we'll talk a little bit about how our current events are affecting our relationship with our brain and body and our outside world. I'm just going to, in the next couple of minutes, zoom in and talk about some exciting new findings related to the body itself. So in my lab, what we do to try to study people's response, their brain-body sort of communication, is we use tools that manipulate body signals. In this case, we've used something that mimics the effect of adrenaline to increase people's heart rates. And what you can see here is these blue and green lines. The blue line is a group of healthy individuals. The green line is a group of anxious individuals receiving either a placebo, so kind of like saline or salt water, versus a low dose or a high dose of this synthetic adrenaline. And what you can see is that as the dose goes up, people's heart rates go up. So if you think about kind of like an anxiety-provoking event, when you notice your heart rate going more, sometimes you can really feel it pounding, and other times maybe it's not going very much. Well, what we found is that anxious individuals, when their heart rate started going, had a higher response. Their heart rates actually showed more acceleration than the people who didn't have high levels of anxiety. And this happened not across all the doses that we tested, but really a lower dose, one that is often at the threshold of awareness. So something that most people probably wouldn't necessarily feel. Their heart rates seem to respond more. And when we looked at kind of what people were feeling in the moment, this is actually sort of a curve of perception. We have them rating, turning a dial and rating, how intense am I feeling my heartbeat right now? You can see that the patients actually felt their heartbeats more intensely at this dose as well. So they reported higher levels of awareness. They were more in tune with the heightened change that was happening, right? They were also more anxious, as you might expect. So at the different doses, they had more levels of anxiety. And so if you think about the impact of clinical levels of anxiety on the brain-body connection, what this suggests to me is that anxiety is not just in the brain, but it's also in the body, okay? It's not just in the central nervous system, your brain and spinal cord, but it also plays a role in the peripheral nervous system. Adrenaline works on receptors in the autonomic nervous system that are connected to the heart. And so when you think about anxiety, it's not just in the head, it's not just in the brain, it's in the nervous system, okay? And so we really need to take a kind of a whole body and a whole systems approach to really be able to understand what the influence might be, okay? Now, in the last couple minutes, I'm going to talk about how we can kind of relate this to what we're all going through in COVID, and then maybe some ways that we can think about intervening on anxiety. So this is a very simplified model that you can think of in terms of the relationship between the body and the brain, and sort of this notion that to keep our inner body, our body sort of system in balance, everything needs to be kind of working right. The signals from our body to our brain need to be flowing appropriately. And the information that we're receiving from the environment as we're moving through it needs to be in tune to maintain that balance, what we call homeostasis. However, when you have a disruption of signals either from within the body or from the environment outside the body, you can see a disruption that alters the balance. And that kind of explains in a way what I think has happened with people who are clinically anxious, that something has happened that has shifted the flow of signals in their body and created an imbalance. You'll note that this paper is very recent, and that's because these authors are reflecting on the role of sort of brain and body in the time of COVID. So they sort of developed this model that tries to link the balance that we try to maintain in our body with a balance sort of between our brains and those of other people's brains, right? So we have regions of our brain that process activity related to ourselves, but we also have regions of the brain that are active in relation to other people. And we're very social creatures. So when you're out in the world, when you're interacting with your family members and your peers and your coworkers, each of them have their own homeostasis, and in some ways their balance can help maintain our balance, right? That's part of staying socially connected. So what these authors were suggesting is that, there's heightened levels of anxiety right now because of this threat to our outer environment, right? With COVID, we're isolated from each other. There are physical threats, but this heightened anxiety may also be disrupting. If the level of anxiety is clinically significant, maybe disrupting sort of that loop within our bodies that makes it hard for us to maintain balance. And if we're having trouble maintaining our inner balance, we're not necessarily able to get help from other people as easily as we would have in the past, because we're more remote, right? We're physically distant, and we need to think about ways that we can sort of maintain these social bonds. And I think this forum actually is a perfect antidote that level of risk, because in a way we're physically distant but not socially isolated, right? And I'm looking forward to sort of the dialogue that we'll have in a little bit. The last thing that I want to mention is that it's one thing to kind of think about, well, okay, there's a disrupted brain-body connection, there's this altered balance in the body, and that's important. But going back to my sort of motivation is, how can we develop new treatments? One thing that I'm very interested in is sort of therapeutic development of ways that we can modulate the brain-body connection. And so a lot of what I've been focusing on is something called flotation rest, or reduced environmental stimulation therapy. It's also called float therapy or flotation therapy. It's been around since the 60s. The astronauts when NASA was sort of developing the race to the moon in the 60s, they initially started studying this unique sort of gravity-free and sort of sound attenuated environment that would try to mimic what it would feel like to be in space. And people found that it was anxiety reducing and somewhat calming. And so my colleague, Justin Feinstein, who's at my institute, has developed this approach to studying whether flotation can be helpful for anxiety. This is an example of our open pool. There's about 2,000 pounds of Epsom salt in here, so more salt than the Dead Sea. You can stand in the water, but as soon as you lay down, you float to the surface, just like this individual. You can float on the surface of the water without holding your breath, without treading water or tensing any muscles. And the notion is that you enter into an environment where the outside world doesn't impinge on your nervous system. Okay, what this looks like from a neuroscience standpoint is, if this is your brain, we attenuate a lot of the information related to things like vision, because we can turn the lights off. In terms of hearing, because it's a soundproofed room. You're not moving when you're in the pool generally, and nobody is touching you or talking to you. And so all of these systems that make up almost half of the brain in terms of processing capacity are not receiving as much input, right? If you think about when you walk around outside, you're using all of these systems to navigate your environment and anticipate and react to what might be happening. So what happens in the brain when you attenuate those? And one of the things that we've found through people's reports is that there's a subjective sense that the signals from within your body are coming up. So we've done some studies with this. This will be my last slide, just sort of showing the data that in clinically anxious individuals, when they were floating, their feeling of their breathing and their heartbeat actually seemed to be heightened. And actually heightened in a way similar to the synthetic adrenaline study that I showed you. But paradoxically, their anxiety levels were actually reduced and their muscle tension was reduced. And they felt more relaxed. They felt more calm. And they even noticed that their blood pressure, when we measured it while they were in the pool, their blood pressure was lower, right? So it was this kind of paradoxical phenomenon where, by reducing some of these environmental pressures, people were becoming more in tune with their inner body, and they were feeling more relaxed. And that's sort of something that has really interested me and as a potential way of powerfully intervening on anxiety. We're doing clinical trials related to this at our institute. Now, the last thing I'll say is that in the era of COVID, right, you can't really get access to this kind of a center. Because we're all socially distancing, but you can do things that would mimic that at home. And one of the things that we've developed, this is a very comfortable recliner. We call it the zero gravity chair. We use it as a active control in some of our studies. But if you think about the idea of sort of taking time to consciously spend time by yourself, find a comfortable position, and just be in tune with your body sensations, whether you're doing a meditation or not. Sort of consciously attending to the need to sort of to not check the news all the time, or not be sort of responding and reacting unconsciously almost to a lot of the signals that are around in our environments can be useful. Of course, I would be remiss to say that meditation is also a powerful tool. And so you don't necessarily have to sort of be in a fancy chair, but if you sort of take the intention, if you look at this dog when he's meditating, he's closing his eyes. So he's also choosing, to be apart from the usual sensory signals of the world and tune in to the signals within. And so I'm looking forward to answering questions and talking more. And I apologize for the sort of research heavy element of my intro, but that's kind of what I think about on a day-to-day basis, and how I'm trying to use neuroscience to better understand mental health. So thank you. It sounds like you're muted. Let me unmute you.
Mute myself. All right, there we go. Can everyone hear me? Okay. So that was amazing. Really interesting kind of overview of your research and your background. And it's always fun to learn why and how people ended up where they are, because, many of us are so subspecialized in our little, cocoon almost. And like, sometimes you're like, how did this person decide to do this flotation stuff or whatever? So I do think it's fascinating, and so many applications possibly to come up with questions around. And I think that the link between the mind and the body is very palpable in Parkinson's disease. As a doctor who listens to our patients and what they feel affects their quality of life the most, many of us focus on things like dyskinesia or tremor or gait or safety aspects, which are important. But so many of our patients talk about the non-motor aspects as the thing that really disables them. And anxiety is probably one of the top things that people complain around. And, there's really been a lack of good research and a lack of good treatments in this arena. And so we borrow things from other areas and try our best to give medications. Many of the normal pills that we give people for anxiety, which I feel like are almost like a Band-Aid to just decrease, alertness. Sometimes they're sedatives. They really aren't great in our patient population because they can make our patients sleepy or confused or off balance. And so I think we wait with bated breath to find your research outcomes. And I think this is an important population to study. On the notion of the mind-body connection, a lot of our patients, because of the autonomic issues that actually are very early on, there's actually proteins that deposit in the heart, in the gut, in these centers throughout the body, kind of like you said, it's not just up here with the Parkinson's patients, it's all over. There's such a link between the autonomic problems that happen in our patients and how they code how they're feeling, and even the relationship with the non-motor issues and how the motor aspects are then felt. And so, and that can even fluctuate depending on their medications. If their pills are working well and the dopamine level is stable, they feel pretty good. And then as the dopamine level sometimes dips, they get into this anxious feeling or unwell, and they can't really even code what it is. And so it sounds like there's probably, like you said, this iceberg where we can kind of see as doctors or caregivers or whoever's around this sense, oh, like you look like you're moving pretty well, or your pills are still working, but they internally feel not well, that they need more medicine or something's wrong, or, that they just don't, feel stable from their, I guess, internal coding of some of these things. So I think there's so many possible research applications from your work. And so, really thrilled to hear about these things. There's a few questions that have come in. One is there a connection between the brain and the gut? I think you showed that on the slide, but maybe we could talk a little bit about that and your sense of that. And, as you know, Parkinson's patients have a tremendous amount of gut problems. There's, constipation, slowed gut emptying, things like that. And these abnormal proteins are actually in the gut. So a lot of interest in the vagus nerve, even in our population.
Yep. Yeah, well, so there absolutely is a connection between the gut and the brain, but it's a fascinating world. It's actually there's sort of two elements to it. One is the communication between the nerves from the gut, like the vagus nerve, as well as others, to the brain, right? So that's that sort of autonomic nervous system, which is that sort of fight or flight or freeze response. But basically, that's the autonomic nervous system is involved in maintaining homeostasis and balance. So there's this sort of trafficking of neural signals that's happening all the time. So when you feel, when you feel full, or you feel a cramp in your stomach, or you feel a rumbling, or you feel you're passing gas. I mean, some of those sort of mechanical sensations, travel through nerves. There's a whole nother world. It's actually, you can think of it as a world within a world. That's the microbiome, which I haven't touched on, but that's, there are more, that has to do with sort of the bacteria, the friendly bacteria for the most part, that live within our gut, and help do things like produce vitamin K and help, metabolize nutrients, and also can produce neurotransmitters, and can secrete signals that cross from the passageway of the gut to affect neurons, but even to send hormones and neurotransmitters into the bloodstream, and then to get into the central nervous system in that way. And so the microbiome is called a world within a world because the number of gut bacteria in the number of bacteria in the gut are actually considered to outnumber the number of cells in the human body. And so it's a fascinating interplay. The other thing that I'll say is that, from a Parkinson's standpoint, a lot of the dysautonomias that we see and the constipation and some of those difficulties, we're very interested in developing tests that can help understand how well people are coding gut signals. So even though I didn't show it, there's a whole other line of research where we're developing some of these tests that can give us a better sense non-invasively without, resorting to things like colonoscopies to try to better understand. I don't have the results to talk about today, but absolutely, it's a great question.
Very cool. So there's been Sahib, could you spend a minute just clarifying what the autonomic nervous system is? Just break it down a little bit, and then, and then we can, because I think there's been a few questions just to clarify that.
Yeah. So we have two nervous systems in our body, which collectively make up the nervous system. So you've got your brain, which is connected to your spinal cord, and helps us to do things like to see, hear, smell, taste, touch. It's very much involved in production of movement. The autonomic nervous system is also thought of as the automatic nervous system because it's a collection of neurons that doesn't have the same structure as the spinal cord or the brain. There's actually clusters of these neurons distributed throughout your body, almost like a spider web, and each of these clusters or each of these webs has a close communication with organs of the body. So you have ones that are connected to different parts of your gut. You have ones that are connected to your liver, to your lungs, to your heart, to your esophagus. And each of them sort of help understand what's happening in the organ. They send messages and receive messages from the organs to the brain. And they do this sort of without your notice, right? They sort of take care of things behind the scenes. That's why it's called automatic. There's sort of two branches of that. They're artificial branches, by the way, but we sort of describe the sympathetic nervous system and the parasympathetic nervous system as the branches of the autonomic or automatic nervous system, because the nerves seem to do different things, right? Sympathetic is the fight, flight, or freeze response. If you were to turn the corner on a walk and encounter a lion chasing after you, you would just react without thinking. Your heart would start pumping more blood. Your gut would shut down digestion. You would have more blood flow to your muscles, and you'd be running, or you'd be fighting the lion, or you'd freeze and hope that it didn't see you, right? kind of like the, T-Rex in Jurassic Park, if you remember that movie. So the parasympathetic nervous system sort of does the opposite. And so when there's abnormalities of those neurons, you may not necessarily always notice it in real time, the way you might notice a tremor, but you might notice constipation or gas or orthostasis or some of the blood pressure abnormalities and even arrhythmias that can happen in Parkinson's.
And one interesting thing that we had talked about, we were talking about exercise and trying to get your heart rate up. A lot of our patients actually can't get their heart rate up. Their heart rate changes are a bit dysfunctional because of that autonomic nervous system, but they still sense anxiety from internal other codes that are kind of interesting. So it might be interesting to study, our patient population and see. I feel like there's, that what you talked about, this sort of, it sounds like, when looking at those graphs, there's the heightened kind of a lower threshold, I guess, for the sensations of anxiety, and then also mounting responses around the anxiety in patients that are anxious. And I think it might be interesting to look at Parkinson's patients, but maybe not just with the heart rate, because it might not be kind of coded in such a way. People are asking for your charts. There's lots of chats around here. Andrea said that this should be a TED Talk. So you're getting a lot of love here, Sahib. So one thing about the float tanks in Parkinson's, I just want to put a thing out there. It's important with our patient population because of that blood pressure dysregulation. If you go in immersions of any sort, hot tubs, things like that, especially where you might get your vessels dilating, and it would be interesting to find out what the temperature of the water is in the float tanks and whether there is this change in blood pressure. I'd like to find that out. You just have to be careful with patients with that blood pressure dysregulation when you get out, or some patients probably should never get really in a hot tub if you feel faint when you stand up. That might just be an indicator that going in a hot tub, like pregnancy or certain other populations with heart problems, should avoid hot tubs. Just be careful. But even swimming pools, because of the change in gravity and the effects on the body, it's always really important with Parkinson's patients to have somebody supervise, if you're having some blood pressure dysregulation. And when you're getting in and out of the pool, to be extra cautious, maybe sit at the side of the pool for a while and then stand up, take your time, hold on to something. Because we don't want people passing out trying to get, feeling sensorially better.
So we did we just finished so actually two things. The temperature of the water is about 94 degrees Fahrenheit, which is the same temperature as the surface of the skin. Whereas hot tubs, a really warm hot tub is about 105 degrees Fahrenheit.
Okay.
So it's not as hot as a hot tub, but it's definitely hotter than a room temperature room. And I think that some of the blood pressure reductions that we saw in our study had to do with vasodilation from the warmth of the water. We did a study in eating disorders, which is another population that has orthostatic hypotension, so this drop in blood pressure when you stand up. And we did a safety trial to see whether there was any potential influence. We didn't see evidence of that, but I wouldn't necessarily be able to extrapolate that to Parkinson's without doing a study. So I would definitely sort of just reemphasize, we have handrails, that we use. We always have people get up slowly. When I float and I get up out of the water, it takes me a few minutes just to feel like I'm coming back to gravity, just based on the weightlessness and then getting used to sort of the weight of my own body. So certainly something to be, careful about.
On that note, so how often are you floating these days? And can you just tell us your own personal experience with the flotation compared to maybe some other, ways, for example, of changing the mental state around meditation or, even breathing exercises, which maybe we'll get a little bit into, because that can also affect the autonomic nervous system.
Yeah. So the way, the scientific definition of meditation that resonates with me the most is characterizing it as a sustained self-regulation of attention. And so obviously, there are many different meditation philosophies and many different traditions, but at a core level, a lot of meditation, especially beginning instructions and things that involve mindfulness practices, start with attending, sort of bringing your attention to the breath or to some other part of your body. Floating, my experience of floating is that, first of all, there's no sustained regulation of attention that's typically involved. You go into this unique environment. When I float, I notice my breathing. I can feel it. I can almost hear it very readily, more so than my usual life. Same thing with my heartbeat. But in some ways, the enhancement of that signal kind of draws my attention to it. But it's not necessarily something that where I'm like in a mindfulness meditation where I've chosen to say, I'm just going to attend to the breath and that's it, right? So I wouldn't equate floating with meditation. It certainly could be compatible. You could always bring a mindfulness practice to it. It's an open question as to whether or not floating could be used as a tool to help people who have trouble with mindfulness because it makes the breathing more salient. But my sense is that that's sort of an early part of the experience. And then you're just sort of imagine being in a room that's so dark that whether your eyes are open or not, you can't see the difference, right? There's nothing to hear. There's no cell phone. For the physicians, there's no pager, right? There's no email for all the workers, for all the family members. There's no, there's nobody that is going to be impinging on your space. No kids, whether they're young or adult, no pets, nothing. And in that kind of unconstrained environment, I often find that my mind can wander. I can direct my thoughts in a particular way. But what's sort of I've found that's sort of consistent with the phenomenon that a lot of other people describe is that by the time I decide to get out, when I come out, I feel refreshed. I feel relaxed. A feeling that kind of persists for me, usually at least for several hours, if not longer sometimes. But my sense of the amount of time that had passed also is different. The first time I floated, I thought I had been in there for only about a half hour. It turns out I was in there for an hour. And so I think there's something about when you change up your routine, and the amount of information coming at you, helps your brain to kind of construct a sense of time. And I think just going back to our current time where we're social distancing, a lot of people have been describing this sense of time kind of changing on them, that sometimes they feel like time is going very slow. In other cases, it may be going fast, but in terms of being able to keep track of time, that's becoming more challenging. And whether, there's this sort of element of a change in our daily signals that help us understand time. I don't know.
Yeah, it's all very interesting. So you mentioned this sort of almost like a resonance between, I guess, when somebody's anxiety levels heightened and how it possibly is palpable for the people around them. And I think there's been a few questions around, caregivers and family members, maybe of people with Parkinson's, or vice versa. I mean, people with Parkinson's and their loved ones. And I do think that is definitely something that we are seeing as, as we have been digesting this information and get into this sort of flurry of, media barrage and stuff. I do think sometimes there's this, if the people that are leading your team or that you're working with are generally a bit calmer, there's sort of a sense of calm. But if one person kind of gets triggered, and then it's sort of like this group kind of hyped up kind of anxiety. And I think that can happen even around families that may be disconnected. I know people will share a video that's like, bad news, and then that will get shared to like 10 other people on a group chat, and everyone then's like, you thought that was bad, here's more information, and I saw this, and it just gets into this sort of kind of wind up kind of stressful situation. So I don't know if you have, maybe Sahib, some practical tips just around how to disconnect from maybe some of the social media, some of the media, you know, setting things. I think you were talking to me about getting dressed in the morning. You know, maybe some practical tips, just as a psychiatrist and as somebody who is trying also to figure out how to navigate these COVID times, you know, that might help everyone. And even for the caregivers and the sort of, there's some households, I think, that are literally dyads. You know, normally a caregiver and a patient or a person with Parkinson's might have had a lot more, you know, people coming into the home or interactions with family members or dropping off at a class and then going about the day with a different sort of situation of respite, maybe for both of them. And now we're kind of confronted with day in, day out for weeks of just being around each other, and then the whatever media, you know, and interactions through either a TV or something, CNN, you know, stuff like that. So.
Yeah, I mean, so one thing is that I think is important is to underscore that mental health is just as important as physical health, and an imbalance of mental health can impact physical health negatively, and a balance of mental health can also positively impact physical health. In terms of information, you know, fear-generating information can be contagious, right? Fear can be contagious, and you know, I think that it's easy to kind of get into a loop where you start worrying about, you encounter one worry-inducing thing, and that leads you to look to another worry-inducing thing, and another, and sometimes that can create a positive feedback loop that goes beyond your own thought process. It can then influence your behavior, and that can influence, you know, a dyadic interaction. You know, if you're prone to sort of having anxious thoughts, and so is your partner, then, you know, one can feed off the other. And so I think that, you know, bringing an intentional focus, like to your daily routine under this sort of new set of circumstances. So thinking about, okay, so realizing that information can have a certain impact, and knowing what types of information. So if you know, you like to stay connected by watching the news or reading the newspaper or going to certain social media sites, you know, realizing, you know, what type of information you're going to get, and maybe putting some structure around that. So I like to try to limit the amount of social media that I'll use to a certain period of the day. You know, I'll also try to set windows for myself where I will go do things that engage my physical body rather than my sort of my mind and sort of mental activities. So walking, you know, is a great opportunity if you can't get outside to walk. You know, doing gentle stretching, you know, something that sort of changes the focus of activity, because it can be easy while sitting at home to sit in one spot and look at a screen, whether you're working or whether you're watching TV or you know, what have you. So so I think that's important. The other thing is there can be ways to positively counteract sort of negative information. So you can help people even from your own home. You can sign petitions. You can go to GoFundMe pages. You know, you can write a nice comment on somebody else's social media. These are all things that sort of making a positive contribution in an information sphere takes some of the balance and the focus away from sort of what's so easy to kind of revert to.
Absolutely. There's been some questions about anti-gravity chairs. Do you know much about this, Sahib? Because I really don't. People are asking things like something about, we have an outdoor gravity chair, anti-gravity patio chair, things like that, whether that's a good thing to try.
Yeah, I think there's a company that actually is called Zero Gravity, or they sell a chair called the Zero Gravity chair. And the marketing behind it is simply that that the contours of the chair and the cushioning are designed to sort of ease the pressure points on the skeletal spine as well as other parts of the body. Usually they kind of swivel and will change the distribution of weight when they do that. And that's the kind of chair that we use for some of our studies. So that can be good. But if you don't have that, a recliner could be just as good, or a hammock, or even a bed, provided you're not sleeping, right? I think one of the best things that we can do, is practice good mental health hygiene, right? I always tell my patients the bed is only for sleeping and sex, right? Don't watch TV in it. If you wanted to add, for zero gravity sort of mind exploration, do it, but that's it. Set a timer, and then when it's up, make sure you don't fall asleep, etc. The other thing I would say is, on the topic of mental health sort of hygiene, is maintaining your circadian rhythm. Going to bed at the same time early enough so that you get enough, ideally 8 hours of sleep if that's what you're able to get. And eat your meals at sort of regular time scales. Try to eat healthy. Wearing different clothes to demarcate different phases of your week. So I try to wear work clothes when I work, because it sort of helps me get in the mindset that I'm doing a certain activity, and then on the weekend or in the evenings wear a different set of clothes. Anything that you can do to sort of maintain the semblance of a routine. Your body actually does that already with melatonin release, natural light balance. So you can actually help that process consciously and unconsciously by sticking to these rhythms.
Sounds good. So just a couple of things here. So Robert said that he's pushing 70 now, seemed to grow less and less anxious because he thinks that I can look back on decades of events that were wonderful and successful. For example, I think of all the good food, delightful environments, mountains, beaches, things like that I've experienced. Can anyone not thank God for such a great life? Yes, I've had some setbacks. After all, I'm a Parky, but none of them have even in a small way amounted to the good I've had. So advice 1, count your blessings. And then he put something about got enough toilet paper. So I think gratitude practices and just being, I think there's a few messages there. One is to take, what you have and be grateful for it, but also to notice these things, and reminiscing even about positive experiences, I think, is a positive way to kind of escape the, the sort of closed environment. And we've been doing that with my children. We've had the beauty of having traveled a lot, and we're looking back on pictures and making dishes of food that we might have liked from other places. There's also been a comment about the breath work and how that can affect the autonomic nervous system, and an interest in learning more about that. We have a yoga teacher actually on Friday who does some amazing yogic practices, and the breath and the movement is very connected in yoga. If there's an interest, we might even be able to have just even a breathing instructor come on, because I've been fascinated by the breathing teachings. Pranayama is what it's called in yoga. So I think we'll try to expand on that a little bit as well. Sahib, do you have anything to say about the gratitude sort of practices? And
yeah, absolutely. I mean, in the history of anxiety psychotherapy, the traditional focus has been on anxiety producing events and sort of what's called negative affect. And there are some effective treatments, but they don't work for everybody. And there's a new wave of therapies that focus on modulating and enhancing positive affect. And so what Robert was talking about is absolutely one of the kinds of practices that you can do, to count your blessings and to actually think about times where you had a very positive experience, positive feelings, where it was a time that was not characterized by anxiety. It's actually very interesting that he says that, because we're developing a new study proposal that purports to do that using manipulation of brain circuitry related to positive affect. So it's absolutely a great point.
Cool. There's one question on interoception and the chakra system. I don't know if you have a comment on that, and we're almost at the top of the hour, so I also want to give you a minute to give us some sort of, positive closure of this session and an inspiration for the future.
Yeah. There is a paper that was written about it. If anyone's interested in going into the details, I'm happy to send it. I don't really know of a direct sort of neural pathway link between a sort of a chakra center and a body center in the traditional neuroscience standpoint, but I'm happy to send that paper.
Yeah. So how this will work is, Sahib, that we'll get any resources that you have, and if you have a breathing resource or any sort of guided meditations that you've found useful for your patients over the years with your anxiety treatments, we can put those up here, and somebody's saying we've really enjoyed the Zoom opportunities offered by PMD. Hope they'll continue after we all go back to our new normal world. Well, yeah. I think we are sort of reflecting on how new normal will be, and maybe we'll be doing this for a while to come. So I've been learning a lot personally, so we'll hopefully we'll be able to continue to get great speakers like Dr. Khalsa here. So Sahib, one last sentence or two, or you have 2 minutes to sort of wrap up for us.
Yeah, I mean, I think what I would say, at this point in time is that we all have a lot of expectations of what's going to happen in our lives, our hopes, our dreams, and we've also had a very big adjustment to them in the last several months, and we're trying to figure out, kind of, for all of us, how does this new normal, how do we live this new normal? What I've been trying to sort of practice is lowering my own expectations of myself, while also practicing what's called radical self-acceptance, right? Knowing that, I'm going to do the best that I can. I'm not going to expect that I'm going to be able to do everything that I wanted to do at the same level, whether it's, in my various roles as a family member, a coworker, a husband, a son, a father, etc. But I'm going to do the best that I can, and trust that that I've done enough. I'm going to accept myself, and I think we could all, if we could all do that. If we couldn't do that before, now is especially a time to do it. What I look forward to is sort of seeing how this shift will hopefully have a more positive, long-standing impact.
Absolutely. I think that's that silver lining, is a sort of hope that we won't ever be the same, but maybe we'll kind of reconnect and care for one another in a different way. So absolutely. And I think that radical self-acceptance, was that what you just said? Yeah. Okay. That's a cool, if you have a resource on that, we should all read that, because I think, we are often very hard on ourselves and sometimes each other. And I think that's part of, the acceptance of a disease like Parkinson's, and trying to figure out sort of the new normal even after a diagnosis like that. So I think that could be very helpful for everyone. Love to get a resource on that. Thank you so much, Sahib. I know you're super busy in Oklahoma, and thanks for taking the time. And this was, I think, really fascinating, and lots of interesting opportunities, I think, to help our patients with your work. So we'll stay tuned. Well, Andrea, back to you.
Thanks for having me.
Thank you so much. That was an amazing 60 minutes. We learned about your research, got academic, learned the science, talked the autonomic system, and then we ended with radical self-acceptance. I mean, our brains just got an amazing workout right there. So thank you to both of you. Thank you for the research that you're doing, and thank you, Dr. Subramanian, for sharing this to us as lay people. I think everyone has been so appreciative and fascinated, And we will want to, I know I'm going to want to watch this again. So we're going to have it posted and we'll share any resources that Dr. Khalsa sends our way. So stay tuned. I put the URL in the chat where you can find that recording. Usually by the end of the day or so, or tomorrow, we'll have that up for you. So, all right, everyone. Well, let's all turn on our cameras and wave bye. Always good to end with some smiles and eye contact. So good to see you, all of you. Bye, Robert. Bye, Mike. Bye, Gary.
Thanks.
Bye. Bye, Sheila. Bye, Denise. Thanks, everyone. Have a great day.